afternoon, everyone.
Yeah,
So
good
I welcome Dr. Sagnik Dutta Sarma and in this interactive session. And I'm pleased to introduce our director, Hermes Voyages director, Mr. Abhijit Das, who will be conducting this session. So please,
Hello.
sir.
Okay, Sagnik and Uma, I welcome you over here in this webinar, which is being organized over here. And you can understand the pandemic situations going on and the business, just everywhere is now shut, you know, there is nothing doing. And there is a huge thing is that we are just going slumming down rather. But we want to know about the current situations of the pandemic situations over here, about the health and hygiene, which you can recommend to our employees over here so that we can work safely. So I would ask you to just go on with this. And this is a 1 hour webinar. And
thank you so much. I'll start now.
Yes, please.
This host has disabled participant screen sharing. Can you please turn that on if possible?
Screen sharing, Swati, on kar do. You are going to share the screen. I think it is there.
Yeah.
Now it is there. Yeah. Okay.
Yeah.
Yes, you can see the screen.
Can you see the presentation?
Yes.
Okay. Okay, so let me introduce myself first. I'm Dr. Sagnik Dutta Sarma. I'm currently working at my family-run hospital, Bindubashini Nursing Home. And today we'll be taking this lecture on this returning to work during the COVID-19 pandemic. What all things you can do, what all steps you can take to minimize the risk. So the first part of this lecture will be taken by me, and which will cover a brief outline of the COVID-19 and what it is, a brief idea of what it is, and then the symptoms and all that. And the second part will be taken by Dr. Devi Mohan, who also works at Bindubashini Nursing Home and who also happens to be my wife. So she will be covering the steps you can take to minimize the risk of transmission to yourself. Okay, so with this, I'll start. Okay, first, before starting, if anybody can tell me any idea you have about COVID-19, anything at all, so that will be nice. Can you just, anybody?
Pushpita, you can, anyone, sorry, also if you want to say something.
Any idea, anything?
Well, what we found out, it's an virus that has been detected in 2019, mostly in the month of December in China's Wuhan, as we see like in the news channels. And slowly and gradually it has been changed its strings, the protein strings, and it has, I think right now in multiple countries there are multiple strings has been found, 36, or in our India I think 26 of different strings of COVID has been detected so far. And it has like effects in multiple organs. It starts from nose, then like nostrils, and then your mouth cavities, and then slowly gradually it enters into your lungs through like sneeze or droplets, as we say.
Very good.
And then your respiratory system fails, your blood clots happens. If your immunity system is very low,
I think it got muted.
There is no medicine as of now.
Yeah, it's fine.
So I'm saying if your immunity is very weak, like older people as we see, then person is doomed majorly. And if their like immunity is good, or your body is actually able to find with antibodies, then you can survive, because there is no drugs as such. Even
Yes.
in all over the world, people are doing trials, multiple
Mm.
drug trials are going on. Even in India, their doctors are only doing is to
Mm.
protect the side effects of that is creating by the virus, just to prevent
Mm.
that.
Mm.
If, like, suppose if I'm a doctor is trying to do is persist the fever, if so
Mm.
that the fever doesn't come with the paracetamol, then with the, if there is a breathing issues, they're giving oxygen and trying to ease the respiratory systems, like
Mm.
that. These are the
Mm.
treatments is going on, that as
Yeah.
much as I know about it.
Yes, and
And
I can see that you have done your homework really well. It's really good. All
because
right.
I have just tasted negative.
Oh, okay, okay. That's like, did you get exposed to anyone recently?
Well, yes. So while I was in travel, like I was coming to office, and I suddenly got sick with
Okay.
fever, and then flu, like symptoms with cough and
I'm
all.
sorry to hear
So
that. Oh.
yeah. So when I went to see the doctor, the first thing he did is to check me for COVID.
Mm.
When that result came negative, then the
Mm.
and the things was persisting, then the other treatments are right now, other
Mm.
tests are going on. So
Mm.
as of now, I'm sure that I'm not COVID positive, but yes,
Mm.
doesn't mean that I will not be exposed it again,
Mm.
because the test clearly says that if right now then it's negative, that doesn't mean that it will not be, you'll not be in future, or you'll not get
Yeah, in the future, you are not like, it's not like you will never get it again. Yes.
exactly, exactly,
So
exactly.
that's why you should be all the more cautious. All right.
Yeah.
So
So
we'll tell
I'm
you how
actually
you can
trying to
take steps to, prevent it from catching in your workplace right now.
Sure,
Okay.
sure, sure.
Okay. So I'll start. So first, brief detail about the coronaviruses. They are a large family of viruses which can cause any sort of illness in animals
Hmm.
and humans, and they have been there since a long time. And most of these coronaviruses cause very mild respiratory problem, like the common cold, which you might have heard. It's like runny nose, sneezing, and things like that, which is extremely mild. It comes and goes on its own without any treatment. But sometimes, as few coronavirus strains have caused extremely dangerous diseases in the past, like SARS and MERS, which were outbreaks which had happened in the Middle East and China in the past, okay, and had caused a high number of fatalities. The most recently discovered coronavirus is called the SARS-CoV-2, or the SARS coronavirus 2, which is the one which we're talking about, which causes this disease called as COVID-19. And as Swati mentioned, that this virus was detected first in China, in Wuhan, in December 2019. But the index case, or the first patient who got affected, or how the patient got affected, we still don't know about it. The research is still going on as to how it came from animals to humans. Okay, so unfortunately, this has spread to almost all the countries in the whole world. And currently, there are about more than 90 lakh cases in the whole world, and about in which India accounts for more than 4.5 lakh cases. And it is continuing to rise every single day. And so this has caused an immense burden to healthcare, which was already strained from the very beginning. I mean, we might see that we might have heard that our countries in India's healthcare is extremely strained, but like you can see that in developed countries like Italy, for example, that like in which has one of the best healthcare systems in the world, and even the United States, they have also failed to, I mean, successfully contain it, and you know how it has affected those countries. And because of this, the burden to healthcare, like I mentioned, and because of the lockdowns imposed, it has hit the economy, the global economy, very hard, and it has affected almost everyone in this world. So now I will just tell you, because you are going to the office place and you have started resuming your work, you must yeah, like, and the lockdown has been relaxed, so you should consider whether you are safe or not. You are not. because the cases, like I mentioned, still continue to rise and exponentially. And you run the risk of infecting yourself because you will be meeting, so like when you resume your workplace, you'll be meeting people from different parts of the different communities, and you run the risk of infecting yourself and also carrying the infection to your home and infecting your family members and your loved ones. So that is how it matters to you. Now, a brief idea about the symptoms of COVID-19. So COVID-19, the most common symptoms which is seen in COVID-19 is fever, dry cough, and tiredness. As you can see, this is a very vague, though that is exactly why sometimes COVID-19 can get misdiagnosed. Sometimes people might not realize that they have COVID-19, and they might spread it to other people. So, and another reason why this virus has successfully spread to so many people is because the symptoms start about 5 to 6 days after you get exposed to COVID-19 usually, but it can range from about 1 to 14 days. So at this period, the person will not exhibit any symptoms, but the person can transmit the disease to others. And this is exactly how it has grown exponentially in this whole world. Okay, and so far everything is clear?
Yeah, quite clear, yes.
Okay, fine.
Pushpita, I think you have anything?
No, it's clear.
Okay,
It's clear.
so now, so the other side effect, the other symptoms of COVID-19, the less common ones are general aches and pains around your in your whole body, blocked nose, headache, something known as conjunctivitis, in which your eyes get swollen. Then you can develop a sore throat. Diarrhea is not that common, but recently there have been some reports of people having loss of taste or smell, and sometimes few people have reported a rash on their skin or discoloration on their fingers. These are not that serious because they begin gradually, and like most of the people, that's a very reassuring fact of COVID-19, is that most of the people have mild symptoms and they might not even need hospital treatment. So, but there are few people who go on to develop serious illness and might require hospital or even ICU treatment, which is about 20% of all people who get COVID-19 develop serious illness, like the red flag signs being difficulty in breathing. So if a person has COVID-19 and the person develops difficulty in breathing or bluish discoloration of the lips, then you should know that it's extremely serious and the person should immediately seek healthcare. And the older people are at high risk, extremely high risk, especially people above 50 years old. So they are at high risk of getting seriously affected, and also people with high blood pressure, heart disease, lung disease, diabetes, cancer, and any other medical condition. So this is extremely important because many people in our country are affected by diabetes and these conditions, and if you combine that with old age, it's a very deadly combination. So but having said that, I would say that anybody can catch COVID-19 and become seriously ill, because there have been reports that young and healthy patients have uh, got COVID-19 and they have been admitted in ICU, and few of them have even died. So how does COVID-19 spread? Okay, so I mean, as you can realize it, you have the risk of getting the virus from a person who already has COVID-19 through something called as droplet spread. So what is droplet spread? As you can see in this photo, this person, like when he sneezes, coughs, or even speaks, tiny droplets are expelled from the person's mouth. This can and these droplets contain the virus. It's a and whenever they speak or sneeze or cough, like I mentioned, these droplets can travel up to a distance of 1 meter in the air. So if a person is in close proximity to this person, they might get the virus. Okay, and so another thing is, because these droplets are relatively heavy, they don't travel far, so it is not an airborne disease. So if you're farther away, then you don't then you don't have the risk of catching this disease. But these droplets sink to the ground and fall on surfaces, which is extremely important in your setting in workplace. So suppose if somebody in your workplace sneezes or coughs, so these droplets, which are visible to the human, which are not visible to the human eye, they can land on surfaces, very common surfaces like tables, desks, doorknobs, chairs, then handrails. And this can be a huge problem, because this can cause like any unsuspecting person who comes and touches these surfaces and then touches his or her face will get the disease. Is there any confusion in this?
No, Sagnik, the confusion is not there, but there are people over here in our workplace who often coughs and all. So some of my colleagues are also, exposed to these things. How to protect them actually? If someone gets cough, doesn't mean that he is a suspected COVID or something like that.
I will that part will be taken by Dr. Uma. Okay, that how do you protect yourself? I'm giving an introductory session on this. Okay, that will be covered.
Your screen is not shared. only COVID-19 returning to work during pandemic. That's what we are seeing.
My screen is not getting shared.
There's only when Dr. Uma, Devi Mohan, and Dr. Sagnik Dutta Sarma is there.
The first slide is showing.
Only the first slide is showing.
Yeah.
Okay, that's very strange, because okay. Can you see it now?
I think you have to reshare it.
Okay, then I'll stop share and start it again. Can you see it now?
The first slide.
After that, it's not coming?
No.
Okay. There seems to be a technical issue now.
No issues, but you can carry on. Let's see. See, there is an icon slideshow.
I've pressed. The slideshow is going on.
On your laptop, it is going on.
Yeah.
But we are unable.
It might happen that Zoom has not been able to transmit the data. It sometimes happens.
Okay,
that might be a technical error from Zoom side.
Whatever. Yeah, it can be like that.
And what can you see this thing? At least not, if not the slideshow, can you see the slides right now?
Yes.
We can see up till 4 slides.
Yeah.
Okay. Yeah. So when I'm putting slideshow on, you're not able to see, I guess.
No. You have to click on the slides. Then the slides are changing.
Okay. Fine. So I'll just keep it like this. Okay. Is this fine now? Can you see it now?
Yes.
Okay. Fine.
Now we can see. Yeah, you have to slide this.
Fine. Okay, so where were we? So how it spreads. Okay, so I explained it to you. Now you might be wondering, can it spread from a person with no symptoms, or or people with very less symptoms? Like, because most of the people have almost no symptoms to very mild symptoms, like I explained before. Yes, it can, unfortunately, and that is how it has spread so much. And some reports have indicated that people with no symptoms can transmit. Okay, but nobody knows how often this happens yet. Still, research is going on. Now, a note because on the virus on surfaces, because this is extremely important, because the virus can survive up to 72 hours on plastic and stainless steel, and about 24 hours on cardboard. And so these are common items which, like if a person sneezes or coughs on them, the virus can survive. But it is also important to know that, because the virus can be easily cleaned with common household disinfectants. Easily killed with common household disinfectants. So that is why you should know this. Okay, now I'll give you a brief outline of the complications of COVID-19. So the most the part of the body which COVID-19 attacks the most is the lungs. Okay, so we get many complications like pneumonia, in which the lungs become swollen and inflamed, and it makes the person harder to breathe for the person. And there we can get something called as acute respiratory failure, in which the lungs cannot perform their function, which is to put oxygen inside the blood and pump out carbon dioxide. So these can happen at the same time, and they can be very deadly. And it can also cause something known as ARDS. So you might have seen in or heard in news that so many ventilators are getting depleted. I mean, so many people in ICU settings with COVID-19 require ventilators. The ones who require ventilators are because of this complication, which is extremely dangerous, in which the fluid, when the lungs get so damaged, that fluid leaks into them, and a person cannot breathe without the help of a ventilator till the lungs recover. And you might be surprised to know that COVID-19 can also cause extreme damage to the liver and kidney, which both can be extremely deadly. And it can also cause something known as secondary infection, in which another germ, most commonly in our country a bacteria, can enter our body, because the body is already weak by fighting this virus. So they can enter the body and cause a fresh infection, and which can also be extremely deadly if it spreads to the whole body, which then is called as sepsis or septic shock, which is another deadly complication. And it can also cause something known as DIC, in which blood clots form, and it can spread to the whole body and be really fatal. So now the most important question of all, is there any treatment? Like Swati said, it was correct. There's no.
It was not Swati. May I correct you?
I'm not. Yeah. So what was her name? I'm sorry.
Pushpita.
Pushpita. Okay. I'm really sorry.
No, it's fine.
It's okay.
Yeah. So there's no treatment or vaccine protocol for COVID-19 at present yet, because why I'm saying yet is because most of the countries have developed, like they are funding a lot on research of this vaccine, and never in history has it been any vaccine so extensively researched and funded. So what is happening is we are coming up with good results. However, clinical tests on humans are still pending, which will be started soon. And we do expect to get a vaccine very quickly, and we must be hopeful, because that is the only way which we can totally stop this disease. Till then, there are many clinical trials going on with certain drugs such as azithromycin, hydroxychloroquine, then recently a steroid also called as dexamethasone. I'm not going too much into details and bore you, but so those drugs have shown some promise, but there further research is needed for confirmation. Okay, so having said all these things, so I must stress on the fact that it is extremely important that a person follows certain steps to prevent him or herself getting COVID-19. And the steps which you can take will be explained to you by Dr. Uma now. So I'll be handing it over to you. I'll be handing it over to her. Thank you.
Thanks. Thank you. Sorry.
Thank you, sir.
Can you hear us? Hello.
Hi.
Yes. Hi.
Hi,
Yeah.
everyone. I can see. Hi. So I can see I can see Swati. I can see, I'm not sure who this is, there's a mask, and I can see a couple of you.
It's Sunny.
Hi. So
With the
I
mask.
hope, no, please don't remove it. You can keep it. Yes, and don't do that. I'll be coming to that. Don't touch the mask. So I hope you're all having a good afternoon. Let's start.
And you are over there is morning till now?
Yes, it's morning time. It's about 9 o'clock here.
Yes. How's the weather there in Manchester?
It's a very pleasant day today, actually. It's a pleasant day here. So, can you see it? Is it still the same presentation, or can you see the purple, blue one?
The blue one, yeah.
Okay. So, yeah, now we are going to talk about what you can do when you all are coming back to work when the pandemic is still going on. So what can you do? I'm sure none of you are clueless about, what are the measures you can take, because we have information coming in from all sides. Like you get advices when you're calling someone, it's there on social media, it's there on TV channels, everywhere. So it's not rocket science. It's some simple basic steps that you can take. So according to WHO, these are the main things that you should see, the basic things that you should see. Firstly, washing your hands. So they advise frequent washing of hands as the most important thing to follow. Secondly, using elbow. So why do you use the elbow for? To cover your face when you're coughing. Some of you might be experiencing symptoms like coughing or sneezing, and so you can use your elbow. You must use your elbow to cover your face in order to protect the other people around you. So the third thing is the face. So on an average, studies show that a human being normally touches their face unconsciously for 15 times in an hour. So it's something we need to consciously think of and not do. Like we might feel like rubbing our eyes or poking our nose. These things we do unknowingly, especially when we are on a day of hectic work. So we have to keep in mind to not do that. And of course, fourth point is maintaining a distance of minimum 3 feet between each other when we are in public. Social distancing, it's like hashtag social distancing is trending on social media now. So the last thing is about how you feel. This means all the symptoms that Dr. Sagnik explained before. If you are feeling any of these symptoms, then you must immediately go to a local hospital or get it checked with your family physician. I'm sure you all know about it. So it's not just the employees or individuals who have to take in the burden of being careful. There are certain things which are advisable for the employer and to be doing as well, and which has to be carried out in the workplace. I checked with Avjit uncle before, and he confirmed to me that all these things are taking place, but we will just briefly go through it in the end. So let's start with the most important step. So I had put in some animations. Now all those things are not showing because the
No, no,
slideshow
yeah,
cannot be
we
done.
can
Yeah.
see this.
So I know it might seem a bit surprising to some of you, at least, because when you follow mainstream media, it seems that masks are the way to go. Masks are the ones which are going to protect you, but it is not. It is hand washing, and the reason is because of the fact that these droplets do not stay in the air for a long time, and you can get them directly from the air. That is, the mask will protect you only if you are near a COVID suspect or diagnosed patient, or someone who might possibly be having it, and they happen to cough or sneeze or even talk loudly when they are within 1 meter distance, that is close proximity within you. So at all other times, what is going to protect you is washing your hands. So all these are times when you must wash hands as recommended by the WHO. But in your office settings, you need to just make sure to take care of these points, which are, of course, when you're coughing or sneezing, then before you eat your food, and after you go to the washroom, which all of us do anyway, and when your hands are visibly dirty, when you have some dirt on your hands, then you must wash your hands.
So,
It's good to keep it.
Can I just
Yes.
over here? We have always, keeping hand sanitizers. Everyone have got these hand sanitizers, and they're all doing it. So the point you stress is washing of the hands. So we have kept these safety measures in our office, and everyone is following that. They have, each one have got their own bottles of hand sanitizers, and they're using this, and also they're using their workplace also. I mean, their
that's
laptops,
excellent.
phones and all there.
Okay, that's really good. That's like the one of the best possible ways you can keep yourself safe. That is by keeping your hands clean. So when do you said everyone has hand sanitizer. So when is hand sanitizer the better option compared to washing your hands with soap and water? Except when your hands are visibly dirty with some sort of dirt which you happen to collect from the surroundings, it's always safe to use the hand sanitizer, alcohol-based hand sanitizer, of course. And it is also very much useful for people who have sensitive skin, because using soap and water frequently can cause some kind of skin irritation. So it's very good that you all are having hand sanitizers, and keep it up. So next is, so these are the recommended steps of how you should sanitize your hand, or you wash it with soap and water. It's the same for both, except for step 8, which is not required for hand sanitization. You must, I know it might seem silly to people that there are actually recommended steps for something as simple as hand sanitization, but unless and until you cover all these areas, there is a high chance that your hand might still be having some contaminant. So just go through the steps with me. You need to get the insides of your palms, between your fingers, the back of both of your hands, the base of your thumb, the back of your fingers, fingernails, and of course the wrists. So these steps have to be followed. And when you're washing your hands for a minimum of 40 seconds, so there are some trends going on to sing the happy birthday song when you are washing your hands, so that you actually last for 40 seconds at least. Now, the next thing is mask. So when do you use a mask? I saw many of you using a mask. So it's a good habit to use a mask. Yes, it's a good habit to use a mask. But when are the recommended times that you should be using it? So if you are a healthy individual, then WHO recommends that you should be using a mask only when you are taking care of sick people, that is, people who are suspected or diagnosed with COVID-19, or if you yourself are experiencing symptoms of coughing or sneezing, in order to protect other people. But in a densely populated country like India, sometimes social distancing measures cannot be 100% ensured, especially in the public transportation and public places. So even for healthy people, it is good to wear a fabric mask when you cannot ensure social distancing 100%. So when you are wearing mask, as you can see, it is only effective when you combine it with hand washing. And also, since all of you are using masks, you should also be knowing how to use it properly so that it actually keeps you safe, and how to dispose it properly so that it does not do damage to the environment and other people. We will get to that. So, what type of mask do you use? So you have all these masks in the, market. The surgical masks you can see. Can you see? Yeah, these are the surgical masks, the N95 masks, these fabric masks. I think some of you've got these fabric masks.
Yes.
And of course, yes, these masks which you can print your face on. I know it looks very tempting, but no, they are not good. So yeah, you might think like, can any of you tell me which one do you think should be used by you all?
I think the top one, this one.
Yes.
Fabric one and the surgical one.
Yes, yes, it is. It's yes and no, because the surgical one has to be like ideally recommended for healthcare workers, for patients, of course, and for people who are taking care of these coronavirus patients, and also for people who are above 60 years and the risk category that Dr. Sagnik explained to you before, when they are going out in public, especially when the social distancing cannot be ensured. So these are the category of people who WHO recommends, but it is also advisable for healthy people to wear it if they are coming from a community or an area where there is a positive case, in a household where there could be a positive case, or if they themselves are experiencing symptoms like we discussed before, to protect other people. But otherwise, in all situations, the fabric masks are the ideal ones for healthy people to wear. Now, what are the do's and don'ts of fabric masks or the cloth masks? So when you are wearing, it's very simple and very basic. When you wear a mask, again, you must always make sure your hands are clean, and you must inspect the mask for any damage or any dirt. Then it should be fitting snugly, or covering your nose, your mouth, and going below your chin. Okay. So you should also make sure that you do not touch the masks on the surface, and you should only handle them by touching with the strings that go behind your ears. Okay. And whenever, the advantage of these fabric masks is that you can reuse them. And whenever you are reusing them, make sure that you put them in a plastic cover and keep it aside, and you do not change the side. Of course, some masks have designated sides which go inside and which go outside, but some of them, especially the homemade ones, do not have that. So make sure that you don't put the side which you have exposed outside against your nose when you are wearing it again. So once you go back home and you remove these masks, it is ideal to wash them every day with disinfectant at a high temperature, and dry them under direct sunlight, and also wash your hands after you handle these masks. Now, what are the don'ts? So these are the ways you should not be wearing your mask. You can see on the left side. I know none of you wear it these ways, especially the last one, but you can commonly see people wearing it below their nose, which is not a good habit, and also removing them and keeping them under your chin, which is also not a good habit at all, because you could be transferring the contaminants collected on the surface to other parts of your body unknowingly. Also, you need to make sure that the mask is not obviously damaged or dirty, and it's not too tight or too loose, and you should never share your masks. Next is the do's and don'ts of the medical masks. So some of you might need to wear medical masks because you are around people, in a community where there are lots of positive cases, or you might be experiencing symptoms of cough and sneezing. In that case, you must use a medical mask, but there are a few, to be exact, only 2 differences between the two. When you are using a medical mask, you must have noticed that there is a small flexible metallic rod that should go on top of your nose and should be pressed on against your nose so that it's snugly fit. And you can never ever use a medical mask, a surgical mask. That should be discarded appropriately in the right bin after you are done using it. So don't be like Bob, use the right mask in the right way, okay? Next. So gloves. Are gloves really necessary? The answer is no. Some people, I have seen some people outside, especially in the grocery stores and things, who wear gloves for extra cautious, extra caution or extra protection. But gloves do not provide any more protection than washing your hands frequently or using the hand sanitizer. So you do not have to worry about getting gloves or not having gloves if you don't have access to them. And even if you do have access to them, it's better to use hand sanitizer or wash your hands regularly. So this slide is about cough etiquette. And this is something that we should do to protect other people around us. If you are experiencing symptoms of cough, sneezing, etc., then you must, like we mentioned in the first slide, remember to cover your mouth at all times, especially when you are around other people, and immediately wash your hands. If you have access to disposable tissues, you can use them as well. That's very good. And discard them off immediately and again, wash your hands. So this is cough etiquette, which most of us do, but sometimes, we forget. So it's good to keep in mind to do this, especially during this time, so that you protect others around you. So social distancing. We all know what is social distancing. Everyone is talking about it. Everyone is trying to do it. But how can you do it in your workplace? These are 6 tips of how you can do it in workplace. Tip number 1, which is making all the communications via, or at least as possible as you can via online, over the telephones, which is what we are doing right now. And if there are meetings which are unavoidable and has to be done person to person, it has to be done in a room which is really large so that the 3 feet distance can be maintained. And also as less number of people should participate in it as possible. Next thing is to eliminate unnecessary travel, non-essential travel, and also keep in regular check with the National Travel Advisory, which I'm sure you guys are much more updated than I am. And also the next thing is, when we all have a break at workplace, we all tend to gather around the tea stalls or the cafeteria and have a little chit chat. But, during this time, it's good to avoid that as well. And it's also a good practice to bring your own lunch and have it at your own desk so that you don't, again, interact a lot with other people. And lastly, when you're traveling to office, if you can, as much as possible, come in your own vehicle, because public transport, again, means increased exposure to the contaminant. And in case you cannot avoid public transport, you must try to come a bit earlier than the rush hours so that you can avoid overcrowding. You can try to come a bit later than the rush hours as well, but I would not advise that. So this is a particular problem that might be common for you guys, that is handshaking, because it's considered a very welcoming and warm gesture, especially in corporate offices. And I know it might seem rude if a client extends their hand out and you do not respond to it. But unfortunately, in these situations, it is good to not engage in handshaking. And even if you do without realizing, it's remind yourself to use that sanitizer bottle that you've got there. And of course, there are some really cool alternatives to handshakes, which I've given here. You can keep a note of them as well. So don't be like this guy. Remember that it's not just the masks that are protecting you. There is hand washing, there is social distancing, and of course, cough etiquette. Now, the workplace. So, does anyone, before we go into this, does anyone want to ask anything about the section that we covered? I'll try my best to clear your doubts, if you have any.
I think Swati can ask about this.
Yes,
Swati, do you have any?
Yes, ma'am. Yes, sir. I have. Ma'am, what is your advice for the safety measures when our employees are coming by public transport? So, how we can deal with that?
Yes. So all the things that we talked about applies. That is, you have to, firstly, especially about public transport, try to come, earlier than the acute rush hour when everyone is traveling to the office, maybe half an hour or 20 minutes early, so that you avoid overcrowding. And secondly, try to maintain social distancing, which is as much as possible. And the next thing which you can do is obviously carry your masks. And if you are having to take public transport in an area where there are multiple positive cases or suspected cases, use the surgical mask. Am I clear?
Yeah,
Okay.
you're clear.
Yes,
Uma,
ma'am.
Uma, what we have doing in our offices.
Yes.
The employees who are coming in the public transport, what we have ensured is this, that they are coming with their dresses on, but before entering the offices, they are just, there is a room over here, and then they are changing the dress, they're keeping that in the closed bag, and then using a dress which they are wearing in the office. This is for the dress and also for the shoes. We are keeping one spare shoes for everyone in the office, and the shoes
good.
Are what we have done. And Swati, can you tell her regarding this?
Yes, sir. We are following that also, and sanitizer we are using frequently. We are using sanitizers. And ma'am, the second question is, ma'am, please guide us regarding the safety procedure. What we have to follow for the visitors in the office, in the workplace.
Yes. Of course, I'll get to that. So, firstly, let me say that, you guys being provided a room and extra shoes for changing your clothes, your willingness to do that, to come inside and go through that trouble. And also, Uncle for his providing all these things for you guys. It's excellent. It's a very good way of keeping the contaminants that you get from the public transport outside the office, office area. So congratulations on doing that to both all of you. So now next question is, what about the visitors who come? Right. So how do we apply all these things when visitors come? Firstly, ideally, I will be getting to that. Ideally, there should be hand sanitizer dispensers in the office which the guests can use. And obviously, if the guests, you cannot insist the guests to change the clothes, so that's out of questions. So if you can provide shoes for the guests, it will be good for them to change into. It will be helpful for you guys, so that they don't bring in any bugs.
What we are asking our guests who are coming, we are asking them to kindly open their shoes outside and enter the office.
Yes, that's very good. Yes,
but they are also following that.
That's very good. Yes. So and also if you can advise them, you can maybe put up a sign where asking them to wear masks if they are experiencing symptoms or if they are in contact with any COVID positive patients, in order to protect the the staff inside the office.
No, we are not allowing anyone to enter the office without a mask.
Yeah, that's also very excellent. So I guess all these measures being taken care of, you guys do not have a risk of contracting it from the visitors. You just make sure that you don't shake hands with them and get it. So yeah, that should be like good. That should be good protection. So these are the basic things that can be done at your workplace, which I think from our discussion we have already covered. First is, keeping the workplace clean and hygienic. I'm sure Avijit uncle, who's gone to this extent to give you guys extra shoes and a room to change, I'm sure
No,
he's
no, no.
getting this also done.
They're bringing their own shoes. They're bringing their own shoes and keeping one spare.
Okay. Anyway, all of you guys, it's very good. Yeah, I'm sure that the tables, the keyboards that you're using already mentioned, I think, and the doorknobs. Yes, the doorknobs, the railings of staircases, all these things, even the chairs, if you are handling them with your hand, all these things are disinfected. All the surfaces where droplets can possibly, settle are disinfected regularly, ideally every day. And it's also a good practice to keep doors open whenever possible so that it allows free movement. You guys can move around freely and each and every person do not have to touch the door handle. The next thing is regular and thorough hand washing, which, you guys have all been provided with hand sanitizers. It would be extremely good if there are hand sanitizer dispensers at the office, which can be regulated with a foot pedal or hands-free automatic hand sanitizers. But it does the job. The small bottles that you are having also does the job. And the next thing which you can do at the workplace is to keep infographics or signs reminding the employees to actually sanitize their hand frequently and also wear a mask whenever necessary. So those are the things to be looked into. And lastly, since we talked about the safe disposal of these masks, it should not be left lying around, because that is, again, you are just spreading the disease again. So there should be bins where you can actually dispose these masks off safely. And the last thing is social distancing, which I already had checked with Uncle and he ensured that it's being maintained. You guys are having, enough distance between your desks and everything. Yes. The other two things are, which we already covered, which is promoting teleworking, online meetings, which we are doing, and avoiding unnecessary and non-essential travels, business travels, and also checking up with the National Travel Advisory. So yeah, these are the things. Then you have, lastly, you have to make sure when you go back home from your workplace. So all the things that we do throughout the day and all the things that has been done for you at the workplace will go into waste if you don't make sure that you do these certain things when you go back home. So what are these things? Obviously, you all know about, keeping shoes outside. This should be kept in mind, especially in houses who have young toddlers crawling on the floor, or any people who are in the risk category, like really old people or people with diseases, diabetes, or maybe cancer patients. In those houses, it's very essential to keep the shoes outside and also directly go to the shower and remove your clothes that you've been wearing in public, especially the ones who are traveling by public transport, and put them, ask someone to keep a plastic cover for you inside the washroom and put these clothes directly in that cover without contaminating the surfaces. Take a good shower and immediately take these clothes without mixing with the rest of the laundry and get them washed. It would be good to, if you have a high temperature setting in your washing machine, it would be really good to use that, a high temperature setting. And of course, do not forget to sanitize your phone, because that is the thing that we most frequently handle. So it's a must to actually sanitize your phone before you interact with your family. And after that, you can have a good time with your family. So that brings us to the end.
So there are some questions from, can you take some questions, Uma?
Yes, definitely, yes. Before that, can I just get to know everyone? Just, can you all just say a hi and your names?
Hi, this is Mona Lisa.
Hi, this is Sunny.
Hi.
I'm Sudipta.
Hi.
I'm Swati.
Swati already met, yes.
Yes, hi, I'm Avijit.
Of course. Yes. Yeah. So ask the questions. I'll try my best to clear them. If not, we will.
I have one question regarding
Sunny
this.
has got a which is Sunny.
Yeah.
You go. Yeah.
Yeah, regarding
Good.
this food, can we avoid this outside food or fast food or the packet food which was available in the outside?
Okay, so there is no evidence that the virus has been transmitted with food yet. Okay, so I don't know if they'll come up tomorrow with something like that, but as of now, nothing that you can actually get the virus by eating infected food. But when you are getting a parcel from outside, again, you have to make sure that you don't you wash your hands after touching the packaging. Especially the covers, the handles, and all that. You thoroughly wash your hands, follow those seven steps, and then you eat the food. So there is nothing wrong in buying food from outside, but of course maintain all those steps that we discussed when you are handling the
Well,
package.
the thing is that if I buy some kind of sweets, so the owner, sweets.
Yes.
So the owner will handle the sweets with their hand also. So
then I'm sorry. Then it's better to avoid that. Better to avoid, because you don't know where the owner's hands have been. Yeah, better to avoid that. Yeah.
Better to avoid that.
Yes.
Okay. Thank you.
Yeah, not because the sweet can actually infect you, but because the owner's hand, you never know where that person has put
Where he put it.
Yes. So,
thank you.
Anything else?
Mona Lisa,
Yeah, ma'am, I have a question.
Yes.
Ma'am, I have a 1.5 years old little girl. Okay. So can you please guide me what what kind of protection I can use for her or myself, because I am going office regularly by using public transport.
Okay.
So is there anything special
I'm sorry, I forgot your name.
Mona Lisa.
Mona Lisa. Okay, so I'll call you Lisa. Yeah.
Yeah, sure.
So Lisa, I think we already covered the things that we must ensure. I can go through them again. So if you see here, when you go back home, I'm sure you know about the shoes and you're practicing that.
Yeah,
so
I'm doing that.
Yes,
I just want to know anything more I can do to protect my daughter from this.
Yes, so it will be a good idea to not interact with her before you take a shower and discard the clothes that you are wearing, which you wore in the public transport. And also, if you can take it a step step ahead, and actually have, like you have in the office, maybe a room in the beginning, at the front of your house, where you can change into a different dress and put the dirty dress and then go inside, so that you don't walk inside the house at all with your clothes which are possibly contaminated. Right. That is, you can take it a step ahead if it's possible for you. It's not possible for everyone to actually do that at their homes. So if you can do that, that will be good. And also, I will surely
try it.
Yes, that's very good actually. And also, if you can, make sure that you don't allow your toddler to handle your phone even after you sanitize it, because there can be some creases and crevices where contaminants can enter, and we can't get to all those areas. So it's good if you don't let them handle the phone. And also other articles like your bag and other articles which you carry outside, which you can't possibly completely disinfect. Better to not have the toddler any contact with those articles.
Okay, thank you so much.
I think Dr. Sagnik.
Ma'am, I have a question, ma'am.
Okay, sorry. Yeah.
Hello.
Yes.
Ma'am, I have a tonsil problem and coughing. So what can I do?
You have a tonsil infection, is it?
Yes.
Yes. So I can see that you're already wearing a mask. Is that a surgical mask?
Yeah, surgical mask.
Okay. So that is one thing you're doing already really good, because since you have symptoms, even though it could be tonsillitis, you must do this to protect others around you. And also, if in case you develop symptoms like a dry cough or a fever of high temperature, then you must consult your family physician or the nearest hospital and get yourself checked with COVID, because it's not necessary, like Sagnik discussed, it's not necessary that COVID shows any particular symptoms. All the symptoms are really vague, and it can be, something like tonsillitis or, actually the coronavirus. So if you are not having any relief of symptoms even after a couple of days, and I don't know if you already consulted a doctor and have been prescribed with antibiotics, have you?
No.
No. So if tonsillitis usually, bacterial infection, so they go down with antibiotics. So if you have been taking them, or if you take them and you still experience no relief, then you should again consult the doctor. And also if you develop any symptoms like dry cough or high temperature and all the symptoms that we went through at the beginning, then you must consult the doctor. Otherwise, if you follow wearing the surgical mask, maintaining cough etiquette, if you have any cough, and also using the hand sanitizers and maintaining social distancing, it should be fine.
Okay, thank you.
Okay, I think Dr. Sagnik would like to say like a bye to all of you.
Any other questions?
Ma'am, can I ask out of the this COVID thing, out of any other question out of this COVID thing?
Of course, I'll try my best to answer that.
Yeah, actually, ma'am, what will happen? I have some migraine problem also. Okay, so it comes when and gastric problem also. So when it goes to a gastric problem, it suddenly attack to my head. Means a lot of attack will be there. So if is anything there for to what do you say to cure this or something like that?
Okay, so
any remedial measures?
Yes. Yeah. So, so the gastric problem is very hard for me to comment on it without actually, getting more details. But for your headache, if you are experiencing severe headache, which you cannot, like, stopping you from working and, causing difficulty, then
it happens when the gastric problem is there.
I see. So see, it's better if you consult, go to the hospital and get some tests done. You have to find out what this gastric problem actually is. Can you explain what do you mean by this gastric problem exactly?
Some kind of, if I drink a less amount of water, suddenly 1 day or 2 days, less amount of water will be drink by me. And suddenly it's becoming kind of paining in my stomach or something like that, and suddenly it goes to my head. Severe headache will be there. I can't see a computer screen or something in the light. This kind of thing happening.
Okay, so in your age group, so I don't really, think that all the headache can be because of the gastric problem, but it can be precipitated, like increased or precipitated by the gastric problem. So in your age group, it can be, there are two things. It can be migraine or another thing called as cluster headache.
I have that migraine problem also. And
you're diagnosed. You're diagnosed with migraine. Yeah. So if you are you taking any prophylaxis for it? Any medicines as prophylaxis?
Medicine, doctor suggest me of taking a Neuro 140.
Okay.
Neuro 140.
Are you taking it?
In a less amount. Yeah, I'm taking it, but in a less amount. But whenever it will attack so you have to take that.
Okay. Okay. So usually if you are on prophylaxis with any drugs, the ideal drugs are amitriptyline or proprin and all. These drugs are the ideal drugs for migraine. So if you are on prophylaxis, you should not be getting attacks. But if you are still getting attacks, then the acute treatment for an attack is taking 1,000 mg strength paracetamol. So that is the acute treatment. And if you still are experiencing symptoms with your prophylaxis and having taking treatment during an acute attack, taking a paracetamol during an acute attack, then you must go and get it checked with the neurologist, because it could be some other complicated.
Is this 1,000 mg paracetamol will affect in my lung or something like that?
No. If you take, the dose which you should not exceed in paracetamol is 8 grams. So 1,000 mg is not anything near that. So you make sure you don't take more than 3 tablets in a day.
Dr.
To
Mohan,
be, yes.
No, you please continue. Then
I'll to be, to keep yourself extremely safe, make sure you don't take more than 3 tablets in a day. And obviously, it's hard for you to, work looking at a computer when you are having an attack. It's not, it is a precipitant. Computer screens and bright lights, they are precipitants. So it is not possible to really expect the medicine to do all the work when you are having a precipitant, which is on the other side increasing the headache. So you have to find some measures to handle your work when you are having an acute attack. So it's good if you don't look at the screen. So can we stick to COVID-19 now? Yes. Anything else?
Yes, Dr. Mohan, my name is Pushpita. So my question is, my husband has to travel a lot because of his work, okay? And during this 2 months of lockdown and, for when the international borders were closed, so he had to stop his work. But again, when the gradually things are coming to a normal, he again had to start with his all the site visits and all his works, because he is working with multiple governments and World Bank for their different projects. So the problem is there in my family. We have elderly people with high blood pressure and respiratory diseases, as well as I have my 18 months old son. Okay. And even I also have being a 32-year-old, I also have a weak immunity system, to be very honest with you, because right now I'm down sick, so I'm not in office. I recently got flu-like symptoms, so I had to go and check myself for COVID testing, and I put myself in a home quarantine for 7 days. But then thankfully come negative. Now my problem, the most what you can say nightmare is that is coming up, that again when he will be traveling, he had to travel very often, like from one side to another, maybe within a 10 to 15 days. Not, it is a very long span that I'm talking, maybe even 2-3 days, that span. So in that situation, how can we protect ourselves, as well as when I'll try to travel to office, how can I protect my office people in that situation?
Okay, so the problem is that your husband has to frequently make travels for his work, and it's causing people, it's putting the people at your home who are already in the risk group at a bigger risk, right?
Exactly.
So I would suggest that if your husband can stay, if he has to very frequently travel, even so, let me ask you a question. If he is traveling so frequently, isn't he undergoing the mandatory quarantine in each place?
Yes. So mandatory quarantine in each place, like what I'll tell you now, right now, just like on this Sunday he will be traveling to Assam, because there is some oil field, if you have heard the news that in Assam there is an oil field fire going, done. Okay, so when he will be traveling, he has all his PPE kits and safety protocols that has been given by his company. And then when he will be returning, he has to undergo a 7 days quarantine. But after 7 days quarantine, he will again travel to some place.
Okay, so when is he coming home? Is he on home quarantine or is he on hotel quarantine?
Home quarantine.
So if he is actually following the home quarantine properly and not having any interaction with you all, then it should not be of any risk to you guys. But if he does experience any symptoms, any sort of mild symptoms at all, especially considering the fact that he is having such extensive travel, it would be ideal if he could stay away for a period, at least until the travels can be reduced.
Because we don't see any hope for getting any proper treatment for COVID until near future. So till then, I cannot ask him to stay away from
the
home.
Scientists are all trying very hard. So yeah,
I know. I think we have also find some news. There are few drugs that has been already
but they are changing need every other day. Yeah, that's
every
true.
other day.
Yeah.
That's the like thing.
I understand.
So
I understand your, worry. It must be extremely agonizing because of so many people in your house who are at risk,
exactly, and
including your child. Yes,
exactly,
but
and even like me also, like I have what we can say, I am an asthmatic, to be very honest with you. I
yes. So you
used
are in
to
risk.
yeah, so I used to take asthma pumps. I used to use a rotaheller for a long duration of time since my college time, and then gradually when I started swimming, things went a very good turn, and I didn't have to use inhaler for a long time. But again, in 2016 I had to had experience because of Delhi's all this, because I was in Delhi, and Delhi is very densely polluted. So on the pollution and all that has to had it again effect.
Yeah.
So that's again a big worry for me. So if you can suggest me something that I can at least be safe for myself and my family, then I can ask him. I cannot ask him to stay away, but yes, that's true.
Yeah, that's right. So yeah, being an asthmatic definitely puts you at risk. Considering the dangers and the practicality that he cannot stay away somewhere, I think it will be a good practice if he wears a mask, especially when he's around all of you. And also practice like having no interaction with you all at all. Like if you can get a hot plate, an induction cooker in the place where he is, and if he can make as much of his meals as possible on his own, and try to isolate himself from you all as much as possible, so that should keep you safe. That's the only way at present, because like you rightly said, we don't have a medicine. So these things like isolating, social distancing, and wearing a mask in this particular situation, he could use a mask around you guys even at home, because it's a special situation where he has to travel so frequently, and
exactly.
you guys are all at risk.
And his travels is not only restricted in India. He has to travel frequently in Bangladesh and any other countries, and like in India you can understand the situation, but other countries you don't, you can't predict that what is happening.
Absolutely, yes. So it would be good if he takes in these measures and tries to avoid, tries to isolate himself from you guys as much as possible, including the meals and things like that. Yeah. And also it will be good if he can have a washroom for himself, and also get all his clothes washed completely separately before, without mixing with any of you guys. So if you follow complete, separation, it should be helpful.
Okay, thank you. I'll discuss with him definitely.
Yes. Okay. So
yeah, Uma, thank you so much. I mean, we had a nice introduction over here.
Yes, I hope at least a little bit, clarity everyone got. I know these things are like everywhere. You can see these things everywhere. About mask, hand washing, everything. I hope at least I could make clear on how to use them correctly and effectively.
Still, your points are very valid, and your points are well taken over here.
Thank you. Yes, and let me take a moment to appreciate the amount of work you guys have done at the office till now, to protect yourself, which is very good, very exemplary. So congratulations on that.
Thank you.
Everyone should do their part, right? So
yes, everyone, we have to do a little bit of things to keep our office.
Yes.
Thank you.
And the families also.
Okay.
Thank you.
Yes. Thank you so much. Yes. So I have a small feedback that I'd like to take from you all. I will email it to Uncle if that's okay. So it's a small form, just a couple of questions. Whatever you felt about the session separately for both of us, please be very truthful and honest, and fill it, and so that we can assess ourselves and improve for our future. Okay.
Sure. Yes.
So thank you so much, everyone. I think Dr. Sagnik would also like to say a goodbye.
Yes.
Hello. Thank you so much, everyone. It was a it was a great session. Okay. So take care. Have a good day.
You too also, and send your questionnaires. We will definitely do the needful.
Thank you so much. Thank you.
Thank you.
Okay.
Thank you.